Hi, I'm Dr. Moalemi from Amelia Heart and Vascular Center, and today I'm going to talk to you about heart murmurs. So what's a heart murmur? A heart murmur is a sound. It's a sound that we describe when we listen to your heart with a stethoscope. When we listen to your heart, we're listening for two sounds. Those two valves are the tricuspid valve and mitral valve, and the dub is the aortic valve and the pulmonic valve, and that happens at the same time. So if we hear a sound between the lub and a dub, you can hear something like lub, sh, dub. That sound is unnatural. It shouldn't be there, and that's called a murmur. We hear murmurs when there's a problems with your valves inside the heart. Valves are double door structures that open and close in perfect harmony with each other, and they're supposed to open up all the way and close all the way to function properly. If your valves don't close properly, then some of the blood that went forward comes right back, and that is called a regurgitation or insufficiency. Since we have 4 valves in the heart, we can have 4 different types of regurgitation. We can have tricuspid regurgitation, mitral regurgitation, aortic valve regurgitation, and pulmonic valve regurgitation. If the valve doesn't open up properly, that's called stenosis. So you can have 4 different types of stenosis. Now that's the murmurs that we hear when we think something is pathologic or not working properly. But you can also have benign murmurs, and those are when your heart is working really hard to push blood around because you are sick with fever, or you have anemia, or you have some other condition which requires for your heart to work harder. And those are benign murmurs because there's nothing wrong with the actual heart. It's just that you're hearing a sound because the heart is working harder. To determine what the murmur is, we do an echocardiogram. An echocardiogram is an ultrasound of the heart that looks at the valves and describes them. There are other conditions that can cause heart murmurs. For example, if your heart is too thickened from having had high blood pressure for a long time, or if you have a condition called hypertrophic cardiomyopathy, where your heart is thick because you congenitally or genetically have this predisposition to a thicker heart. But in any case, a heart murmur is a sound, and that sound has to be further evaluated with an ultrasound. We'll talk about that in further lessons. So that's all for this video, and we hope to see you in the next lesson.